welcome back to another new edition of Windows in Current Affairs. And today it's Doctors' Day, and of course, not only the whole nation is commemorating and celebrating that very, very special day in our lives, but also the whole world. Of course, why? Because this particular profession have come a long way, especially the past 2 years, with the advent of COVID-19 last year, and this current COVID and the other types of COVID, God forbidden, inshallah, that we do not suffer from that much with intensity. But doctors have come a long way. Doctors have taken more than they could take. They have sacrificed everything to be able to save our nation, to be looking over patients, to be present 24/7. And we have seen in documentaries and videos over the social media and everywhere those heroes, and we call them our white heroes, or our white army. Today we celebrate our white army, and we're going to be talking about everything that could be related to that particular section in society in this edition of Windows on Current Affairs. And we're very delighted to be having with us Dr. Magdy Adly. He's an inspector at Health Insurance Department. Good evening, Dr. Adly.
Good evening.
But before we get into more detail, we're going to give you something on behalf of Nile TV to support and empower our white army in Egypt throughout the whole nation. Let us go to take a short break and come back to you.
This is a message of support on behalf of Nile TV International to our Angels of Mercy. Thank you for everything that you're doing. Thank you for your efforts. A big salute to you on Nile TV.
We are just behind you. We support you. We support your effort. Please stay strong for us, and please stay safe.
We're sending a message of support from Nile TV International to all the heroes of the medical team here in Egypt, all the healthcare professionals, doctors and nurses who stand in the front line in the battle against coronavirus. Thank you, our Angels of Mercy.
Let's agree on something first. No words can describe how much we do appreciate the efforts exerted by the medical staff, the White Army, the Angels of Mercy. So, in Nile TV International, we decided to do it our way, a campaign of gratitude and appreciation. A big thank you.
Only on Nile TV International have we decided to take the initiative to thank the Angels of Mercy and put themselves in danger in order to save our lives from the coronavirus.
From all of us here at Nile TV International, we'd like to thank all the medical practitioners, whether you are doctors, nurses, general hands, any lab technicians, anybody who works at any hospital all across the country. We would like to thank you, our Angels of Mercy, the Egyptian White Army, for all your efforts in the fight against COVID-19.
In a message of support and an initiative dedicated by Nile International to our Angels of Mercy here in Egypt, we want to thank you very much for your support, for risking your lives, being on the front line to combat this pandemic. Stay safe. We support you. Take good care of yourself.
Sending out a message of support and encouragement through Nile TV International's initiative for the White Army of Egypt, for the Angels of Mercy, the doctors and nurses all over the country fighting and on the front line of the fight against the COVID-19 pandemic all over the world, and more specifically in Egypt, to be staying safe, and for the rest of the Egyptians to be staying home.
Excellency, Mr. John Jabour, the World Health Organization representative in Egypt.
I see that I have strong measures on ground to protect the Egyptian community. My morale should be also high.
زي ما وجهت الشكر مرة قبل كده، بكرر شكري مرة تاني لكل العناصر الطبية اللي موجودة في مصر.
Welcome back, and like we said, of course, this was only a very modest attempt on our behalf here in Nile TV to express our gratitude to the White Army in support and in power to this particular very important section society. Very delighted to be having with us Dr. Magdy Adly. He's an inspector at Health Insurance Department. Good evening, Dr. Adly.
Good evening. Good evening.
And of course, before we start off with our too many details when we talk about the White Army, but today the Doctor Syndicate conference was held and was attended by Your Excellency the Minister of Health, Dr. Haile Zaid, and the head of the syndicate at the same time to commemorate and celebrate together the achievements of the White Army and also to pay tribute to those heroes.
That's right.
And we're going to be showing videos of some highlights of that conference that was held, and there was a very impressive speech that was given by Her Excellency Dr. Haile Zaid, the Minister of Health, on that very special day, because when we talk about the White Army, we surely talk with passion.
That's right. Let me say in the beginning, Happy New Year for all, every single member of White Heroes or White Army. Today is Doctor's Day. And by the way, Doctor's Day is not Egyptian Doctor's Day only, but it's a global celebration all over the world. Every country celebrates.
Is it the same day also?
No, not exactly. Here in Egypt, we can shed more light on Egyptian Doctor Day, but it's not the same day all over the world. Like USA is 30th of March. Doctor's Day in USA is 30th of March. And this is related to an accident happened in 1842. So they choose that 30th of March for that Doctor's Day. But in general, every country all over the world have a celebration for Doctor's Day. Because you know, doctors and all members of White Army are fighting all the time to secure the life of people.
Right, and as you can see here, that is the press conference that was held, or a seminar, as we can see, it was held at the Doctor Syndicate and attended by the Minister of Health, Dr. Haile Zaid, and the head of the syndicate at the same time.
This is very good.
Right, paying tribute to our White Army, members of the White Army. And let us also, before we forget, we, from where we stand here, express our gratitude those heroes, and draw the attention of our viewers that President Abdel Fattah al-Sisi have given his directives to name most of the streets of the administrative capital under the names of the victims of the doctor victims of COVID-19 who fell as martyrs, as we consider them martyrs. To protect the nation and protect the patients and protect the citizens. They have sacrificed their lives.
That's right. The White Army sacrificed everything to protect people, and a lot of people are in between us now because of these people, because that first line of defense. They sacrifice with their families, sacrifice with their lives even. Even the last 2 years, the job of White Army was very, very dangerous, because they work in an environmental of viral environmental, and can be hit any second. He can be hit with COVID-19, and sometimes he can't go to his family. Like 15 days, isolated for 15 days, can't see his children or his wife. This is not an easy job. So what happened today emphasized that the country support them very strongly, and they don't forget them. Even Mr. President today give an order to name some of the streets of a new capital with the name of doctors victim who died because of COVID-19. In fact, this period of time, country is caring with White Army and doctors all specialties, not only certain specialty, but all specialties, physicians, pharmacists, dentists, nurses, all of them have the same treatment or from the government or from the country because of what they do these days. And we can talk about the history even of Doctors' Day.
Here we can see the head of the Doctors Syndicate giving a very impressive speech, as he paid tribute to the victims of the COVID-19, and also gave his respect to their families who have endured a lot.
That's we supposed to shed more light about that, because we're supposed to care give a care for their families, because sometimes the doctor who has been dead because of COVID-19 is was responsible for a family containing children, yes, and wife, and so on. So these people must take the country supposed to support them in this period of time.
Right. If you can excuse me, you have with us now over the line Dr. Gamila Nasr, and she is a professor at the Medicine University. Good evening, Dr. Nasr.
Hello, how are you? How are you? It's nice meeting you now, and the perfect image of Egypt and the Nile TV.
Thank you so much. That's so nice of you. And also, let me also tell you today, greet you at the Doctor's Day. Happy Doctor's Day to you.
Very good. This is a happy Doctor's Day to all the doctors in Egypt and maybe all over the world. So, wishing you to be more able to give and more able to cure the humans and do a lot and
Right.
support them.
Dr. Gamila, let us talk about the situation, the contemporary situation or the current situation as we're fighting this very fierce pandemic that is evolving every day and giving us different faces and different features. You as a doctor and every doctor in the nation, you are spending 24/7 of your lives inside hospitals and clinics and everything, caring for the citizens. What exactly are the right or efficient requirements that are supposed to be given in order to provide a safe haven for a doctor who is caring for a patient?
Well, we all know that, the COVID-19 pandemic, and we are really, we are facing, a big challenge as humanity. Maybe needs leadership and solidarity to defeat the COVID-19, and we know it is really the definite global health crisis of our time and the greatest challenge we have faced since the World War II. So I think this is a very important item, and maybe I need to say that our weapon to combat the COVID-19 are the doctors. So we need to keep their health fine, and so that they will able to still sacrifice their lives for the sake of the patients. So I think we're still ourselves need to be stick to the precautions as washing hands and all the sanitary situations needed. And for the doctors, we have to, of course, give them all the measures to keep their life safe. Perfect vaccinations, and this is what our government are doing now. They should also encourage them to still adopt to the precautionary measures, wearing masks all over the world, and also to give them, all the devices needed in order to protect themselves, as well as also to teach them again and again and again how they can protect themselves.
Right. Dr. Gamila Nasr, we'd like to thank you so much for your time and talking to Windows and Current Affairs, and you have a beautiful night. I guess we're going to go to a short break. And with us now is, of course, still with us in the studio, Dr. Magdy Adly, and he is Inspector at Health Insurance Department. Dr. Magdy, we need to know the history behind that very, very important day, paying tribute to the White Army. How did it start?
Egyptian Doctors' Day start in 1827, in the time of Muhammad Ali. I think this information is not known by many people, but it's start in 1827 in the time of Muhammad Ali. Before 1827 there was no faculty of medicine or any institute for teaching medicine. So by 1827 they established the medicine school with the help of the private doctor of Muhammad Ali, he was Dr. Klotbek. There is a region in Ramses called Klotbek. Klotbek was a doctor, and he advised him to establish a medical school for teaching medicine, and he agreed for that opinion. Then they established the first medical school in a region called now Abu Zabal in the east of Cairo. They started with like 100 students, and they bring doctors or teachers from France for teaching medicine in many specialties like anatomy, like chemistry, like even pharmaceutical science. From that time, they choose 18th of March is the Doctor Day. Every 18th of March, we celebrate with Doctor Day, but many people doesn't know that celebration because only that 2 or 3 last years because of a global pandemic of COVID-19 and the sacrificing of doctors and White Army. So, but there is a celebration of Doctor Days which started by 1827 in the time of Muhammad Ali.
Let us talk also about the different campaigns, health campaigns that was given by the Egyptian administration and also the directives of President Abdel Fattah Sisi. Actually, it was his idea to start a series of very, very successful campaigns that even he spread that campaigns to different countries in Africa when Egypt assumed the chairmanship of the African Union. From that we remember the 100 million lives, the promoting the lives and health of the Egyptian women, and also Egypt fighting hepatitis and the chronic disease, and even Egypt taking was acquainted by the international community and the United Nations, the WHO, sorry, for fighting one of the
COVID-19
frontline countries who fought the hepatitis C.
Oh, hepatitis C. Look, since Mr. President have had the leadership of country, one of the most greatest files which having a lot of problems was the file of health. And that was a very a great challenge for him, for building a healthy Egyptian human being. So he started, in fact, since 6 years ago, how to improve the file of the health file in Egypt, how to keep people in health conditions all the time. We start with many, we planned for many, and we applied it for many campaigns. First was the 1 million lives campaign, which target like 62 million Egyptian citizens. Investigation and checking up for chronic disease like hypertension, like diabetes, like other chronic disease. Checking up and investigation, and in the same time providing a medicine for free to check up and take your medicine if you have a problem, and following up the case. That was the first, and by the way, that campaign was very successful, by the way, and all global or international agency confirmed that, and they was very proud for that what happened. Then we come to the Egyptian great women and campaign of improvement of health of Egyptian women for the early diagnosis of breast cancer and disease related to the women. And in fact, like 28 million Egyptian women was investigated and benefit from that campaign. Because you know that breast cancer must be diagnosed early, because if women doesn't know that, it will become very dangerous to treat it. Then we come to the campaign of scholar students for early diagnosis of anemic diseases and the deficiency of vitamin D and deficiency of growth hormone. I think that campaign even still working right now.
Right, it has been on for a long time, even before the COVID.
They plan to cover all schools.
Right, we're going to talk in detail about where it started and which governorates, but we're going to take a phone call right now, but I need you to continue that on a promise that you would continue in detail. We have with us Dr. Dr. Mustafa Sadiq. He is a professor at Medicine University. Good evening, Dr. Sadiq.
Good evening. How are you?
I'm fine. Happy Doctor's Day to you. Let us talk about, we were talking about the different campaigns. Dr. Magdy Adly is with us here live in the studio, and we were talking about the different campaigns that the Egyptian administration have launched all over Egypt and even in different countries in Africa also. So how important are those campaigns, and what have they added to the health file in Egypt?
I guess they're really very important for the health of the people and for the health of the medical providers. Now they are giving vaccines to most of the medical profession all over Egypt, and I think they even send vaccines to other countries in the region. So I guess this is really very important, because it's to control this horrible disease. It's very, very, very important, and we appreciate their efforts for this.
Right. From your own assessment as a doctor, which is the most sustainable campaign that could add to the nation and get to the best interests of the citizens also at the same time?
I guess that the most important thing is to explain the danger of this disease for everybody, and to encourage people to follow the ways to prevent this disease, and to stop gathering, and to stop all the unnecessary gathering that people do so that we can control this disease, and to encourage people to take the vaccine, so that they, with all our efforts, we can win this thing and get rid of this, return to our normal life.
And on that very special day, what is your message to your colleagues and the future doctors, the students at Medicine University? What exact piece of advice would you give it to them?
Regarding this disease, or regarding...
no, in general.
In general, that we should, we should treat the patients as one of our family, and we should give them trust, and we should continue, reading and reading and reading, because medicine is always evolving, and so that we can be updated and give the best treatment for every patient, and for our country too, for our region.
Right, Dr. Magdy Adly, you are a professor at Medicine University. We'd like to thank you so much talking to Windows on Current Affairs. Welcome back, and we're still on with the Doctor's Day. And Dr. Magdy, we were talking about the campaigns.
Yes.
And the chronic disease, and
yes.
Launching medicine and providing medicine to the reach of every citizen.
As I told you, we start with the part of campaigns, and we talk about the women health campaign and the scholar student campaign for early diagnosis of anemic disease and deficiency of vitamin D and growth hormone. And we can come to, by the way, this campaign is still continue right now to cover all the students all over the country, because you know to improve the health of students early is very, very important thing. And we come to the greatest campaign from even my point of view, which was the hepatitis C campaign. This campaign was a very successful experience happened ever. Even medical university or University of Medicine outside Egypt in Europe even teach that Egyptian experience in their universities, because it was the greatest challenge for Egypt to eliminate hepatitis C. You know, before we start the treatment of hepatitis C, the number of people who was infected with hepatitis C over 12 million patient, and these people were not healthy enough to contribute for the international income, so that Mr. President target these people to give them a hope of life, to be a healthy people and to share for building our country. And we can talk about something which was very important also, which is the waiting list. You know, before pandemic of COVID-19, there was something called waiting list for surgical operation for different specialties. Like 400,000 operation would have been done as an order, direct order from Mr. President, to finish that waiting list. And these waiting lists, I think it cost the country like over 6 billion Egyptian pound. But the most important point is that the health of Egyptian citizen is the number one for Mr. President. We can talk also about the greatest achievement of country and effort, which is the comprehensive insurance system. And that was a very good and great step and move in medical map, in Egyptian medical map, to keep all Egyptians under the umbrella of insurance, health insurance system.
Yes,
because
we need to talk.
know,
that was going to be my second question to you. The comprehensive health insurance system that was also launched by President Abdel Fattah al-Sisi upon his directives, and he started with the governorates outside Cairo.
Yes.
To give to reach to the disabled and the less privileged, and ease in their lives and help them, assist them fight diseases and fight the different difficulties that health difficulties that they may suffer from.
Yes.
They started with Port Said.
They start the first stage was Port Said, and like 1 million person benefit from that project, and they touch the how is their health care convert of and how they can go to any even private hospitals or private clinics and pay a little money and even for investigation or laboratory testing they paying a little money. Even the medicine itself, they pay like 10% only from the price of medicine. By the way, I forget to say something for the point of hepatitis C campaign. I supposed to shed more light about it. Egypt, after it succeed to eliminate hepatitis C from all over from Egypt, start now as the rule of leadership in a Middle East region and in in Africa as a general, to help another countries, African countries,
to take the lead role.
Yes, yes, to treat that
and
problem.
follow suit our
yes, and
footsteps.
providing them with even the medicine of hepatitis C.
Really?
Yes, this is that is sure. So that the international society looking for Egypt now as a leader for that point of view, for that point of hepatitis C. We come to the point of comprehensive insurance system. Country would blame that applying comprehensive insurance system. Comprehensive insurance system is an idea that the rich people contributed or contribute with the country to give a good medical care service for poor people. This is the main idea. That people can pay contributions or fees so that and a country support with a financial budget so that even the poor people who don't have enough money for medical treatment can have a very good medical service like any other international country, like in Europe, like in USA, which called Obamacare. I think you can read about it. So that when people contribute seriously, so the time for applying comprehensive insurance system doesn't take a long time. Even Mr. President last few days on a launch of in Ismailia for Mugamma Gala Hospital said that we're supposed to decrease the time of applying comprehensive insurance system from 15 years, which is the plain time to apply that comprehensive insurance system for all governorates, 27 governorates, to 10 years only to contain all Egyptians. Because you know, right now there is people having insurance system under the umbrella of insurance system and other doesn't have insurance system. So he would like to contain all Egyptians under the umbrella of insurance, health insurance system. So anybody doesn't have enough money to go to any even private hospital, now he can go and having a good and professional medical care service.
Right. On this very optimistic note, we're going to be leaving it here with this very important fight in the nation and the White Army. Happy Doctor's Day to you, and thank you for coming.
Thank you very much.
Celebrating that very special day with Nile TV.
I am so happy to be with you tonight, but I would like to add a little.
Okay, but real quick because we're out of time.
I'd like to add that we're supposed to support,
of course,
medical army, White Army as possible as we can.
Of course, and respect. Also.
Yeah, this is
and we started with ourselves here in Nile TV,
right.
and we have given our token of respect and support in a little document, that we have shown it earlier in the program, and we keep showing it in jingles. I guess that would bring us to the end of this edition of Windows on Current Affairs and Doctor's Day. Many thanks to Dr. Magdy Adly. He was here live with us in the studio. He's Inspector at Health Insurance Department. And until we see you again next week, that's a goodbye.